everyone, my name is Binga-an, and today, together with my partner Miss Cherie's Bulay, we are going to talk about drowning. Now, in this video, we are going to talk about its definition, the types, factors, pathophysiology, symptoms, diagnosis, nursing management, treatment, and its complications. Now, let's start. Definition. Submersion injury or near drowning occurs when a patient initially survives suffocation while submerged in a liquid medium. Drowning refers to death within 24 hours after a submersion event. Submersion can be intentional or unintentional. Hypoxemia and acidosis are the primary problems in victims of submersion injury. Now, there are three types of submersion injury. We have dry, wet, and secondary. For dry, it is in which the victim doesn't aspirate fluid but suffers respiratory obstruction or asphyxia. It happens in 10% to 15% of patients. For wet, it is in which the victim aspirates fluid and suffers from asphyxia or secondary changes due to fluid aspiration. About 85% of patients has this. For secondary, it is in which the victim suffers a recurrence of respiratory distress, usually aspiration pneumonia or pulmonary edema, within minutes or 1 to 2 days after a submersion injury incident. For factors, we have factors that increase survival and factors that have no effect on survival. For factors that increases survival, we have immediate quality CPR or cardiopulmonary resuscitation, cold water, less than 70 degrees Fahrenheit or 21.1 degrees Celsius, shorter immersion time, less struggle, no associated injuries. For factors that have no effect on survival, we have sex, race, and swimming ability, eating a meal before the event, type of water, could be salt water or fresh water, use of abdominal thrusts like Heimlich maneuver during resuscitation attempts, concurrent illness such as cardiac or pulmonary disease. For pathophysiology, of course, submersion injury must occur. Then water temperature greater than 68 degrees Fahrenheit or 20 degrees Celsius. It can be salt water aspiration or fresh water aspiration. For salt water aspiration, fluid is drawn into the alveoli, which washes out the surfactant. Protein-rich exudate floods the alveoli. That results to reduced compliance. For freshwater aspiration, water over alveolar capillary membrane, then surfactants are destroyed, which results to alveolar instability and atelectasis. These will cause widespread atelectasis, then ventilation perfusion mismatch. This will further lead to intrapulmonary shunting and will result to pulmonary edema. For water temperature less than 68 degrees Fahrenheit, there is a rapid cooling of the body, then catecholamine released caused by struggle before loss of consciousness, which leads to vasoconstriction. Then decreased cerebral and cardiac oxygen consumption from cooled body and shunting of blood to brain and heart. Body then is in a dormant state and rewarming, leading to systemic vasodilation and hypotension, which then fluid challenges to increase blood pressure, which will also lead to pulmonary edema. Submersion greater than 5 minutes is generally associated with severe neurologic damage. For symptoms, we have fever, confusion, unconsciousness, irritability, lethargy, restlessness, substernal chest pain, shallow or gasping respirations, cough that produces a pink frothy fluid, vomiting, abdominal distension, apnea, asystole, bradycardia, and tachycardia. Next will be my partner Therese Bulay in continuing to discuss about drowning.